Hello and welcome to the channel. Are you questioning whether you or someone you care about may be pre-diabetic, but you're not exactly sure what to look for? Then keep watching, because in this video, I'm going to cover what prediabetes is, who gets prediabetes, and the major factors that put someone at risk for developing prediabetes, or even full-blown type 2 diabetes. If you stick around to the end, I'm also going to tell you about a simple solution thousands of people have used to get their blood sugar under control and reduce the risk of developing, or even reversing prediabetes. What is prediabetes? Prediabetes is a condition when a person's blood sugar levels are consistently higher than normal, but not high enough to be considered type 2 diabetes. It is a major health concern, since it can lead to type 2 diabetes, but it can also be a precursor to heart disease and certain types of cancer. One of the scariest things about prediabetes is that it presents almost no symptoms, so millions of people who have it don't even know. Some estimates say as much as 33% of US adults have prediabetes, and over 80% of them are completely unaware of it. This is why understanding the risk factors for prediabetes is so important. When you recognize the warning signs, you can make changes to reverse prediabetes and prevent type 2 diabetes. Who gets prediabetes? Anyone can develop insulin resistance, or prediabetes, but people who have the genetic or lifestyle risk factors that I'm about to share are more likely to develop it. They are also more likely to develop type 2 diabetes and other related conditions, such as hypertension and heart disease. Risk factors for prediabetes. When evaluating risk factors for prediabetes, it is also important to understand that there are two categories of risk factors and the difference between them. They are categorized as modifiable and non-modifiable risk factors. Modifiable means they can be controlled by the lifestyle choices you make. Those that you can't change are non-modifiable risk factors. Let's start by looking at the non-modifiable risk factors for prediabetes. These factors include age. Although diabetes can develop at any age, the risk of prediabetes increases after age 35. Family history. Your risk of prediabetes increases if you have a parent or sibling with type 2 diabetes. Race or ethnicity. Certain people, races, and ethnicities are more likely to develop prediabetes. These include African American, Alaska Native, American Indian, Asian American, Hispanic, Latino, Native Hawaiian, or Pacific Islander American people. Gestational diabetes. If you develop diabetes during pregnancy, you are at increased risk of developing diabetes again later in life. Polycystic ovary syndrome. Women with this common condition also have a higher risk of developing prediabetes. It is characterized by irregular menstrual periods, excessive hair growth, and obesity. Next are the modifiable risk factors. These are the factors you can, and should, do something about to reduce your risk of developing diabetes. Weight. Obesity is a leading risk factor for prediabetes. The more fatty tissue you have, particularly around your abdomen, the more insulin-resistant your cells become. Waist circumference. A large waist size may also indicate insulin resistance. Men with waists larger than 40 inches and women with waists larger than 35 inches are more likely to develop insulin resistance. Diet. Eating red meat, processed meat, and consuming sugar-sweetened beverages are all known to increase the risk of prediabetes. Physical inactivity. The less active you are, the more likely you are to develop prediabetes. Sleep. People suffering from obstructive sleep apnea, a condition that causes sleep interruptions on a regular basis, also have an increased risk of insulin resistance. Smoking. Smoking increases insulin resistance, which leads to prediabetes, and increases the likelihood of it fully developing into type 2 diabetes. Smoking also increases your risk of complications from diabetes. Prediabetes is also linked to metabolic syndrome, which is a combination of other serious health conditions, including having a large waist, high blood pressure, having low levels of good cholesterol, and high triglycerides. Even though risk factors such as family history, age, or ethnicity cannot be changed, lifestyle risk factors such as eating, physical activity, and weight can. Focusing on the factors under your control will go a long way toward lowering your risk of developing insulin resistance, prediabetes, or something even worse. To learn about the simple blood sugar solution I mentioned earlier, the one that thousands of other people are using to get their blood sugar under control, go to healthtipblog.com/glucose. If you found this video helpful, please give it a like, or share it with someone who would benefit from this information. To get notified of new content, subscribe to my channel, and hit the bell for instant notification. And if you want to know 7 ways to treat or prevent prediabetes, click here and watch this video next. Thanks for watching.